Now that you have a sense of how your loved one is changing and why keeping their choices at the center matters, let's take a closer look at exactly what we'll cover in the rest of this training and why it's organized the way it is. There's a term you'll likely hear your care navigator or the home health agency team use: ADLs, short for activities of daily living. These are the basic things almost everyone does every day, often without thinking twice about them. But for someone with declining physical or cognitive ability, they can become genuinely difficult or even impossible to do alone. This term matters beyond just vocabulary. Doctors and care teams actually use a person's ability to perform ADLs as a real measuring stick. It can shape a care plan, and in some cases, it's part of what determines whether someone needs more home care support or a higher level of care altogether. So, when your care navigator or a nurse asks about these, it's not small talk. It's genuinely part of how your loved one's care gets shaped. There are 6 of these core daily activities, and we'll spend time on each one: eating, not cooking, just the physical act of getting food into the body safely; dressing, getting clothes on and off, which uses more strength and coordination than it seems; bathing, washing and hygiene; toileting, bathroom use, and related hygiene, like brushing teeth and grooming; transferring, moving from one place to another, like bed to chair, or sitting to standing continence; the ability to control bladder and bowel function. We're going to take each of these one at a time in upcoming modules so you have real practical guidance for each, rather than one overwhelming module trying to cover everything at once. We'll also go further than just these 6. We'll spend time on skincare and wound prevention, safety and fall prevention, tools that support independence, and how to recognize pain or emotional changes your loved one might not put into words. And we'll close with what to do if a real emergency comes up, so you feel ready rather than caught off guard. Each module is short, about 20 minutes, so you can move through this at whatever pace works for your schedule. None of this is about becoming a medical professional. It's about understanding, in real and practical terms, what your loved one needs day to day, and feeling steady and prepared to help with each task as needed.